Hi, this is Paul Mills. This is based around a project I started in Afro-Caribbean barbershops in January 2023. We measured over 214 blood pressures. 10% of the people who we measured had blood pressure above 200. Up to 4% of them had stopped taking their medicines for high blood pressure. The majority of them, well, 4% had stopped taking the blood pressure medicines due to the side effects. They were advised to speak to their pharmacist and speak to their GP after they recorded their blood pressure for 7 days, and were also given advice and support about non-drug ways to try to reduce their blood pressure if possible. 34 other people were detected with high blood pressure. They were given lifestyle advice. Letters were sent to their GP detailing the blood pressure readings and also the advice and support to take their blood pressure reading for 7 days and then to show them to their GP and their pharmacist. But more importantly, a clear explanation was given to the people that if they didn't get their blood pressure under control, if they needed to, then death, heart attack, strokes, and other severe illnesses would be a result of not getting their blood pressure under control. Even one participant had not had their blood pressure taken for at least 4 or 5 years. Lifestyle advice and support. The 12-week physical activity referral program for exercise was explained to people so they could then speak to their GP to see whether or not they matched the criteria to be referred into this program. Lifestyle choices: cigarettes, alcohol, exercise, salt intake, fruit and veg, some of the things that we discussed. Also, encouraging people to speak to their GP about weight loss programs using the Birmingham Community NHS Trust website library app, which is publicly available on the website, encouraging people to check the food labels for their salt, and also using the British Dietetic Association website to give people the correct information of what they needed to understand about fruit and veg and other eating related conditions. Advice and support and websites information about stop smoking services when and if people needed to, and information about stress and mindfulness from the website library app as well. We encourage people to try to self-manage their blood pressure, focusing on, okay, have a look at your diet and find out how much salt are you intaking and do you need to reduce it? Does your weight need to be reduced to help your blood pressure? Does your cholesterol need to be reduced? Do you know what it is and do you need to reduce it? Is your waist size posing a threat to your heart and your overall health? Alcohol intake. Find out how many units you're taking and if you need to reduce it. Again, saturated fat information, explained it to people. Caffeine-based drinks and its potential impact on blood pressure, and also other foods that contain information as well. So we encourage people to find out how much they were intaking of these things or what their level was, and then did they need to reduce it. Find out also, we encourage people, what did they need to increase? Did they need to increase their exercise, the fruit, the veg, the water, the whole meal based foods, increasing their sleep and also their relaxation times, all the things that can have an impact on high blood pressure. How would you like the information? So we created some resources, videos, and then directed people to other printed information, telephone helplines and websites to help them to self-manage their condition. The root cause, find and address the root cause. Sometimes the root cause can be changed through lifestyle changes to help people to manage their risk. So we encourage people to find what the root cause was if possible, and then to do something about reducing their risk. And this is an ongoing program that's still taking place in Birmingham. November 2024 will be the next results.